Hi and welcome to the bite-sized introduction to SM in Buckinghamshire for children and young people. So, what is selective mutism? SM is situational mutism. This means that it's when a person can speak in some situations but not in others. So the classic case you might be aware of is a child who can speak perfectly freely at home, as you would expect any child to, chatting, talking freely. But when they go into setting, school, that's when they are not able to speak. Or some children can speak to one or two people that they're comfortable with, but when there are more people around who might overhear them, that's when they are unable to speak. Or some children might be able to talk about really factual things that they're certain of, but when it becomes more about emotions and thoughts, that's when they cannot speak. Some children can answer direct questions, but are unable to initiate interactions. This is low-profile selective mutism and is often missed, but it can be just as serious. For example, a child, if they hurt themselves, may not be able to ask for help. Now, this is something that's really important to understand. Selective mutism is not a choice. These children and young people are not choosing not to speak. They are unable to speak in certain situations. So, what can we do to help? Helpful things include accepting and encouraging all forms of communication by all children. So think of times when children are usually expected to speak, such as the register. Could you have children answer either by speaking or by raising their hand, for example? Similarly, circle time. Could children say something or show something? Encourage other ways of joining in, so make sure that activities are not only focused on speaking. For example, noise-making games are great for younger children, or simple turn-taking games. It's important to talk openly about how things are difficult now, but you know that they will get easier. Having that hope is really important, as is making it clear that you're taking the pressure off to talk now, with the knowledge that they can talk and will be able to talk one day. This is something that speech and language therapists say a lot. So make comments instead of asking questions. A nice phrase to think of is that questions test and comments teach. But also asking a question is particularly unfair if you know that they cannot answer you. So instead of saying, "Oh, what are you drawing?" you might say, "Oh, I like the colours you've used there," or "I wonder what kind of people might live in that house." Then you're giving an opportunity to speak, but you're not pressurising the child to speak. They'll be able to speak to you when they're ready. SM is often said to be like a phobia, and you can treat it like one. So have a think about some common phobias like fear of lifts or small spaces. If you came to some lifts with a colleague and they said, "Oh, I've actually got a phobia of lifts, so I'm going to take the stairs and see you up there," you probably wouldn't react by saying no and trying to force them into the lift. That would be traumatic for them. But you also might know that they may choose to just always take the stairs, or they may choose to one day seek treatment for it, and that's okay either way. Fear of the dark is very common, but we don't advise treating it by locking a child into a dark room until they get over it. Instead, we may use light in the hallway or a night light and gradually get them used to sleeping in the dark. It's the same with children with SM. It's not appropriate to try and force them to speak, and also we know that they won't be able to start speaking until they're generally comfortable and ready to work on it. So, having spoken about things that are helpful, what are unhelpful things? What are things that we might do with the best of intentions to try to help but may actually make things worse? So what doesn't help? Trying to bribe someone to speak or punish them if they don't. This is really not helpful because it goes against the general idea of taking the pressure away to speak. Trying to force someone to say hello, please, thank you is also not helpful. These kind of social niceties, greetings, are actually some of the most difficult things to say for children with SM. Asking lots of questions, again, this is really putting pressure on a child to speak, and it's really unfair if they're not able to answer you. When a child is anxious about something, it can be tempting to just spring it on them at the last minute. They will often get through it just by adrenaline rush, but it will make them more anxious in general, and it may make them more anxious about the thing next time. Avoid making recordings or videos of a child without their knowledge and consent. We need to be open about how we know talking is difficult, and they're going to be able to talk to people in their own time, and we can't bypass that by showing people their voice when they're not ready. Also, some forms of therapy use recordings in a really structured way and at the child's own pace. It's also important not to just stick with the status quo. Children with SM need to have hope that it will get easier one day. If you have a child with speech anxiety, it's important to have a plan in place and to intervene early. If you're concerned about a child you think might have SM, please don't wait. Early intervention is crucial. So, what next? If you're concerned about a child or young person with SM, please ask us for one of our settings packs and follow the guidance within that for 6 weeks. At the end of that pack, there are some questionnaires. And if you're still concerned, please make a referral with those questionnaires completed. Our current referral guidelines can be found on our website. Following a diagnosis, we will guide you through making sure the environment is right for the child or young person and taking small steps towards confident speaking in all those situations I talked about earlier. Thank you for listening, and please get in touch with us if you have any questions.